mind. I'm sure you all know. So this is the ICS Carers catch-up call. Today we're going to be having safety and data report around young carers, and we'll be hearing from Meg Kelly from Social Finance. Thanks, Meg. We'll also be talking about the Accelerated Reform Fund, and we will have Chris and Nigel from SCIE. Now, before we do that, we have committed in the past that we will do a little NHS England update, which we'll email out after today. But very quickly, as you know, we had our online conference, Commitment to Carers conference on the 24th of June. The event brought together unpaid carers, professionals, systems leaders and policymakers to share best practice. We had great attendance. We had 235 we topped out at. Just in terms of some of the highlights, we had Stephen Kinnock, MP, Minister of State for Care, and he gave us a recorded message where he acknowledged the vital contribution of unpaid carers and reiterated the government's commitment to elevating carers' voice. And we also had a panel discussion, a shift from expert to equal partner, and this was chaired by Dave Sweeney, and then we had Kirsty McHugh, CEO of Carers Trust, Helen Walker, CEO of Carers UK, and then we had a big gun there. We had Sally Warren, Director General of the 10-year plan from DHSC. We also had a number of unpaid carers, Raj, Hazel, and Hazel was from the volunteer from the African and Caribbean Care Group. One of the big sort of highlights of that is we did some evaluation, and 86% of attendees were either highly likely or likely to change unpaid carers' practices in their organisation due to what they heard from the conference. That's a really exciting figure for us. During June as well, we also had Carers Week. There were a number of themes during Carers Week, which I will pop into the comments box now. Over the sessions, we had 548 registered for Carers Week sessions. We haven't got the evaluation yet because that's being pulled together by a central function, but from what we hear, it went well. The partnership board, which was the Unpaid Carers Partnership Board, which was going to be held on the 2nd of July, that's now been moved to the 24th of July because, as we know, the long-term plan is out today. So we're just going to take a little bit of time to digest that before we go into the partnership board. Let me see if there's anything else. I think that is it. So without further ado, we shall invite Meg. Hello, Meg. Welcome. Thank you for speaking today.
Hello. Thank you so much. You'll have to excuse if my voice is a bit croaky. I'm ill and I'm also cat sitting, but I'm allergic to cats, so that's not helped. Thanks. Yeah, so this is our safety and data report that me and Tam put together from Social Finance around building data infrastructure that keeps young carers seen and safe. We can move to the next slide, please. Thank you. So a little bit of background on Social Finance. We're not-for-profit and we work with partners to design, fund and scale solutions to complex and enduring social issues, both in the UK and globally. The young carers work stream that we've done, it came from broader work that we've done with children and young people around sort of like youth violence and exclusion, where we realised that there were a lot of young carers within this data set and that we were working with and that hadn't had their caring responsibilities identified, and so they were being unaddressed, and that contributed towards the other vulnerabilities that they were experiencing. So we decided to do a young carers work stream in and of itself. Next slide, please. Young carers, they face significantly poorer outcomes than their non-caring peers, and that can permeate many different aspects of their life, including education, health and safety. And so part of our work, what we did was work with partners across the sector to develop some system priorities. And those are enhancing data use in identification research, recognising young carers and their complex identities, codifying best practice and what works, encouraging whole family and whole system approaches to supporting young carers, tackling financial constraints and making the case. And so this report addresses system priority 1, so enhancing data use in identification research. Essentially, if we want to support young carers effectively, we need to have a really, really solid data infrastructure surrounding them that is robust, representative, and where the data is shared safely between organisations. And this will allow us to identify and support more young carers and understand their experiences better to tailor support needs. Next slide, please. So there are fundamental challenges across local authorities, education and health that make identifying and supporting young carers difficult, and this contributes to lack of collection of data, sharing of data and effective usage of data. So in local authorities, they can struggle to make the case for investing in local carers and young carers locally, and that can be due to financial pressures, limited capacity, which we know is something that people sort of struggle with across the board, and also a lack of statutory guidance that can be used as a lever to secure funding resources to support young carers, and additionally a lack of joined up data. In education, again, there is a lack of capacity to support young carers, as well as a lack of awareness about who young carers are, what they experience, how to identify them, and how to support them. In health, the processes aren't always in place to utilise the close proximity that health workers can have to identify and support young carers. So, for example, community health teams that might enter into the homes of households where their young carers might not have the adequate training or data collection processes in place to identify and support young carers where they have proximity to where others may not. And then across all of this is the issue of data sharing not being effective. And that means that the young carers might be identified by one organisation, but they don't receive comprehensive support. The support offers might not be linked to provide whole system support, and as well as this, they could be identified by one organisation and not another. Next slide, please. As well as these institutional barriers, there's also social and cultural barriers. That means young carers don't always identify themselves to authorities. One of these being statutory services. Young carers and their families can be hesitant to identify themselves and how much care they're providing because they're fearful of the perceived consequences to themselves and their families if social services are involved. There can be a fear around just social service involvement in general, and then possible removal from the home, interference within parents and family life, etc. This can be even worse for young carers from global majority or low-income backgrounds due to a distrust of the government and statutory services because of institutionalised discrimination. And additionally, for young carers caring for someone with mental ill health or substance misuse issues, it can be particularly difficult to them also because of the stigma surrounding these conditions, and wanting to identify those to authorities. And then as well as this, there's cultural differences. So for some young people, caring is just a key part of their culture, and this simple label of just young carer might not be a holistic enough picture of their situation, and that can lead to underreporting and a lack of tailored support. Next slide, please. So we want to create a data infrastructure that allows young carers to be identified safely and supports more young carers to come forward and ask for help. And by safety and data, we mean creating data systems where the safety of young carers is the first priority. Essentially, ethics have to come first when working with young carers. It's not just about collecting and sharing information, it's about making sure young carers feel safe and supported within the system. If young people don't feel safe, they often go unnoticed and choose not to ask for help when they need it most. So yeah, safeguarding well-being should always be the priority, and by handling their data with this care, we can create solutions that genuinely improve young carers' lives and without reducing them to just data points. Next slide, please. So safety first data infrastructure supports identifying and supporting young carers consists of identification being matched with support. And it's not easy for young carers to ask for help, and when they do, they should get support straight away. If we're creating systems to identify more young carers, we need to make sure that they actually receive the help that they need. It's also crucial to think about when taking a relational approach might be better. So data is personal and it needs a personal approach at the end of the day. Focusing only on processes isn't always the best solution. Sometimes the real need is to think about who's collecting the data, how they're collecting the data, and how that can be embedded within a relational approach across organisations. Young carers and their families should be involved in co-designing updates to systems and processes. And we need some standardised data to understand young care experiences at a national level, but there's also real value in co-designing local data capture that reflects what young carers need within their own communities. And we need to understand the whole family context. So understanding young carers' family context helps us know what the right support should look like, and it helps us tackle the issue at its root cause. But we do need to be transparent with the family about how data is being used and think through the ethical considerations in understanding this whole family context, because you're not just justifying using data on one person, but multiple people. It's also important to build trust with young carers and families. So not all young carers want to be identified or receive support. Some choose to stay invisible, as we've touched on, and using data tools to find them can risk breaching their trust and overriding their consent. And then lastly, structural racism and bias needs to be tackled head on. If we're collecting data from young carers who are wary of government, we need to acknowledge that up front, and they should fully understand how their data will be used, and we need to actively challenge bias throughout this process. Next slide, please. Data infrastructure we can think about as being composed of three different categories. So data collection quality, data usage, and data sharing. Data quality can be best understood as the fitness for purpose of a data set, so whether the data is of high enough quality to effectively and accurately serve its purpose. Data usage is about how well we use the information we collect to identify and support young carers, and that includes both data directly from the young carer and the use of related data sets and tools. And with data sharing, so as we've touched on, this isn't always shared effectively between organisations. That makes it harder to identify and support young carers and provide comprehensive whole system support. Next slide, please. On data collection and quality, we can think of data quality being made up of three components. Accuracy. So when data on young carers isn't accurate, policies can be misguided and resources can be wasted. It can be inaccurate because collection processes aren't effective for frontline workers. Families might be holding back information because they don't trust statutory services, and that leaves us with an incomplete picture that doesn't reflect real experiences. Representation is another component. So currently marginalised young carers are being overlooked in the data, and that means that they're missing out on the support that they need. Stigma that we've discussed around substance misuse and mental health can make it even harder for these groups to come forward, and so they are being missed in the data. Essentially, if we want truly inclusive support, we really need to close this gap and make sure that all young carers are seen and counted. And then another component is relevancy. So currently we're missing key details within young carer data, and that can mean that support isn't always hitting the mark. Things like physical health and the risk of exploitation aren't always captured, and that can make it harder to understand what young carers really need. And if we can change this, we can build a fuller picture of young carer experiences and therefore make better decisions about support and broader policy and create a more reflective national picture. So recommendations that we have around this, better data quality. It will mean that we have a clearer picture of who young carers are and what they're going through. And when we do truly understand their demographics and experiences, we can direct resources where they're needed most, tailor support that actually helps them and gets to the root issue, as well as make a stronger case for funding. One of these is to work with frontline staff to find practical ways to make day-to-day data collection more accurate and complete. Frontline workers, as we spoke about with the local authority struggles, they're often stretched thin, and it can be tough to make data collection a priority, and especially when the value of it isn't clear to frontline staff or the systems are too complicated. So we need to design data processes alongside frontline workers, making it easier for them to manage and clearly demonstrating to them how it will help improve support services. Another recommendation is to conduct local audits to understand existing size, quality and overlap of data sets. So data on young carers is often scattered across different organisations, and that can make it tough to fully understand their needs. The local areas should audit the data that they currently have, and they can spot the gaps then. They can check its quality and make sure that the right ethical safeguards are in place, and that will help organisations work together and create a more coordinated and whole family approach. And then lastly, young carers and their families should know exactly how their personal data will be used and who will have access to it. So when systems are transparent in this way, the trust grows, and that leads to better data. And families are more willing to share when they understand how the information will be used and how it could benefit them to share. Sorry. And yeah, so this clear and open communication, it helps remove fear around data sharing and making sure that the data we collect is accurately and most importantly leads to better support. Next slide, please. When it comes to data usage, data needs to be used to support the individual and understand their wider needs. So some additional context around this, it should be used to deliver whole family responses and provide support at an individual level. Data should reflect young carers' whole family context, and this will allow for providing support that's truly tailored to the young carer's needs. When data is limited, we can end up focusing too much on the individual young carer and miss the root causes. And taking that whole family approach would lead to a more effective long-term support. Data should also be used to understand trends, allocate resources, and tailor local support offers. So by using data to spot signs that a person might be a young carer, such as school absenteeism, we can identify more hidden young carers. And understanding patterns in the young carer population helps to improve how we identify and support them, and again provides better evidence to leverage for resources. Some recommendations we have with this is to explore how existing data within case management systems can be used to create a richer understanding of the experiences of young carers. Organisations could explore means like linking records of the person being cared for to the young carer's file, and therefore adding more context to their situation. Another means could be adding markers to the records of adults with long-term health issues to show whether there's been an inquiry into whether children in the household are young carers. Another recommendation we have here is to contribute the results of data analysis towards the national picture of young carers. So organisations should share data on young carers which has been anonymised and with consent that will help build a national picture of young carers, and that can ensure that resources are used where they're needed most and that policies reflect the real needs and experiences of young carers. Next slide, please. So for data sharing, ultimately data needs to be shared in a way that keeps young carers seen and safe. Some additional context for this is consent. So getting consent from young carers and families to share information can be challenging due to the concerns about how their data will be used, and again, that involvement of further statutory services. So one barrier with data sharing is on a very human level of just can you get this consent to create that whole family, whole system response. Data sharing agreements and information governments can be especially tricky to set up. Sensitive data on young people, it requires robust DSAs and information governance procedures. This can be time consuming and resource intensive to set up, and especially for health authorities and other services, this can be especially tricky due to different confidentiality rules and concerns about data sharing, discouraging people from engaging with health services. Some recommendations we have for this. So improving data sharing, it would help create a whole system approach, and this would allow the broader context of young carers and their families to be considered in ensuring they receive the support that they need. So organisations should appoint a dedicated person to manage information governance, review current data processes to identify gaps and areas for improvement, and assess whether new data sharing processes will deliver clear, tangible benefits, so avoiding unnecessary sharing, not just sharing data for data sharing's sake. And this will result in more up-to-date information being shared between services that can improve timely and effective support, as well as more comprehensive support that takes into account the whole family context of the young carer and the various vulnerabilities that they may be facing. Last slide, please. Takeaways and call to action. So on a more national level, better local data will enhance support and young carers to contribute to a national understanding of the young carer reality, what they need, how we can best support them, and this will improve policy, resource allocation and support. A stronger focus on data within the young carers sector will deepen understanding of young carer identities, and that includes overlapping vulnerabilities like consent, exploitation risk, and care experience. And additionally, we really encourage a public conversation on safety in data, and around self-identification and how we can support these young people and their families to come forward in a safe way, and this will reduce the likelihood of crisis interventions if we can encourage young carers and families to access services before they reach that point. If you are interested in talking further with social finance about this, please do reach out to me and Tan, and we have our emails there at the bottom. Thanks so much.
Meg, thanks for a really helpful presentation. As Meg said, you'll get some claps there, Meg. Meg has left her email in the final slide there, so please do reach out to Meg if you'd like to hear any more. We will be taking questions at the end, Meg, so we're gonna carry on. So if you could stand, that would be wonderful. For those of you that have joined us, we have been introducing ourselves in the comments box and saying what our favourite ice cream is. A highlight for me today was Simon from Hertfordshire talking about an apple strudel ice cream that he ate in 1981, so that's 43 years ago. So Simon, if you remember that, that was a good ice cream. Also, thank you to Chloe, who talked about what a fantastic conference it was last week. As you all know, we had our Carers Conference, National Carers Conference last week. So now I'm going to be introducing Chris and Nigel from the Accelerator Reform Fund. So Chris and Nigel, would you like to come on and introduce yourself and take us through your presentation, please?
Sure. Thank you very much, and thanks very much for inviting us here this morning. So I'm Chris Dadson. I'm Sky's Director of Business Development and Marketing. And I also oversee our relationship with the Department for Health and Social Care, which means that over the last year, I've been overseeing the support that we've provided to the DHSC's Accelerating Reform Fund. Nigel, do you want to introduce yourself?
Okay, thank you. My name is Nigel. I'm the Monitoring, Evaluation and Learning Manager at Sky, and I've been working on the Accelerating Reform Fund for the past year. And we're here just to share some of the learnings that we've got from the project. Yep.
Right, thank you. So next slide, please. We'll go through the presentation. This is just a really quickly bit of background for those of you who don't know. The Accelerating Reform Fund was a DHSC grant fund that was launched about a year and a half ago. Just over £40 million was given out in grants to almost every single local authority in the country. The purpose of the money was to kickstart scaling innovation in social care projects. And the idea was that local authorities would come together to form consortia within an integrated care system. So actually 42 ICS consortia submitted expressions of interest for the grants. The expectation was that these consortia work closely with other partners, NHS, care providers, charities, unpaid carers, people drawing on care and support with lived experience. It was a non-competitive process, and every ICS was expected to submit a minimum of 2 projects. So there was a large number of projects supported through this process. And Sky, Social Care and Super Excellence, was the support partner to DHSC and to the projects on this. So we've been providing over the last year and a half support to projects on the ground. And there was also a national evaluation partner, which is Ipsos, and they've been kind of reporting to DHSC on their evaluation findings, and they'll be publishing their findings in the coming months. Next slide, please. Yeah, so this is a first of its kind, really, a kind of £40 million grant fund to support scaling innovation in social care with a real emphasis on unpaid carers. This is a first of its kind. So it was treated from the beginning as a kind of learning opportunity. So, you know, Sky's job was to support projects in local areas to identify enablers and barriers, ensure that local authorities benefited from valuable shared learnings, peer support and expert insights, capturing the learning on how to maximize, how to successfully tackle the barriers and maximize enablers, and ensure that the collection of evidence to support the fund's evaluation, which is commissioned to Ipsos. So we've been working really closely with Ipsos. So there's always been a learning component, but also to share and disseminate the learnings to really help build the case, in particular for commissioners, to make the case to actually invest in and support innovation, you know, and different ways of working. Next slide, please. So ultimately, there are 122 projects, which is a huge number of projects to be supporting over 1 or 2 years. 149 local authorities participated, so almost every local authority in the country. 69%, so 2/3 of the projects had an element relating to unpaid carers. So unpaid carers really was the kind of really strong theme throughout the projects. There were over 35 different care providers collaborating with the ICS consortia to deliver projects, and throughout Ipsos has been an evaluation partner. That's just a sense of the kind of the scale of the stakeholder partnerships and relationships. Next slide, please. So just a little bit on unpaid carers. There was a requirement from the beginning that at least 1 project per expression of interest be focused on unpaid carers. So always at least 50% of the projects would have an element of unpaid carers. And ultimately, out of the 122 projects, 86 have got an element involving unpaid carers, and 73 of them are directly focused on unpaid carers. So what you'll see across the country is such a strong emphasis on unpaid carer related projects, identifying unpaid carers, supporting unpaid carers, etc. Next slide, please. Just a little bit on the timeline. So it was the fund was launched in October 2023, and projects had a very short amount of time, 2 months, to submit an expression of interest by January. And then the first grants were made out in March 2024 to kickstart the projects. The projects started up, and we started providing our support from April 2024. So our support from the beginning was to support on design, startup, setup of projects as they got going. There was the problem of the general election in July, which really paused things. So with PERDA in advance of the election and then post-election, there was a lack of clarity on whether the second tranche of grant funding, because the 42 million was split into 2 tranches. So all the projects got half the money to kickstart, to get going, and they were meant to get the second tranche of funding in August. But the delay with the general election and uncertainty of whether funding would continue meant that actually there wasn't a confirmation of that until November. So there's this big 6 months pause in the middle. We continue to provide support over this period, but with the uncertainty, a lot of the projects paused activity, stopped recruitments they were doing to recruit project managers and other key posts. So the reality is that many of the projects didn't properly start work until around Christmas time last year. So we're now in the position now in July 2025 where all of the projects have started. They're kind of in early phases of implementation, but certainly they haven't completed, and certainly they haven't kind of shared the learnings of implementation and adoption yet. Next slide, please. So some of the things we did last year. So we did some workshops in April to kind of kickstart the projects and provide early support. So we provided support around our program office. People knew what kind of support we could provide. We provided support specifically around project planning and stakeholder engagement, really kind of acknowledging the large number of stakeholder relationships that all these projects would have. And we provided support around theories of change, impact frameworks and evaluation. It's really crucial for these kind of one-off innovative projects that they have a real understanding of the differences that they're making, and they're able to capture data on the change that they're making as well. So that support is something that we provided, and also Ipsos has provided some of that support to some projects too. Next slide, please. In July, we did kind of deeper dive workshops into thematic and topical areas. So just to kind of bring out a couple of kind of key points. So there's some of the themes that we looked at were things like shared lives arrangements, community and community networks, kind of really chiming with the kind of the neighbourhood focus now around. Hospital discharge, a really big area, digital tools for self-care as well. So those were some of the themes that were coming up from the expressions of interest. And very much we provided workshops based on our analysis of the expressions of interest and the areas where projects said to us that they wanted support on. In terms of some of the topics, we provided further support on things like co-production, stakeholder mapping, cultural change, really making sure that from the beginning, projects were thinking about adoption, embedding and sustainability, and digital literacy. We knew a lot of the projects had digital components, whether it was use of an app, use of a development of a new data platform. And we knew that, as we know at Sky from years of working in this space, digital literacy and kind of confidence in managing digital projects is low and needs a lot of support. So it's just a bit of a sense of kind of some of the things that we did. Next slide, please. And then based on the emerging early evidence from Ipsos over last summer, and some of the findings that we were finding from our own workshops, webinars, surveys, mid-year reports and interviews, we designed a kind of more in-depth support program from after the summer. So bespoke one-to-one support with the project leads, often taking a critical friend role. At Sky, we provide consultancy services to central government and local government. But this was a little bit different to the kind of business support and consultancy that we had anticipated. It was much more of a kind of facilitator role, helping projects navigate the complexity of working with lots and lots of partners, the governance around that, and I guess getting the agreement on projects and project milestones. So that was a kind of a key thing that we did. We also established communities of practice in key areas, such as things like digital self-service, hospital discharge, shared living arrangements, etc., to encourage peer-to-peer learning. And over last year, we had more than 60 projects represented in these different communities of practice. And many of those communities of practice led to the projects themselves actually connecting with each other. And we know that some of those conversations are ongoing. We had an event yesterday, in fact, and I was chatting to one of the projects who was saying that they'd, from the communities of practice, connected with another project, and that kind of conversation and sharing of documents and learning was still ongoing. And then we've been providing ongoing lighter touch support and ad hoc requests for those with more general support needs. So things like, for instance, project might say that they're setting up a co-production governance and can we help them? We've had experts by experience as one of our work streams, and we've been able to connect those experts by experience to provide advice and guidance on how to do something like that. Next slide, please. So just a little bit on the emerging barriers and enablers to innovation. And I think if Nigel hasn't already, he's going to pop into the chat a link to a report that we published yesterday called Embracing Change, which has got our interim findings. So in terms of some, there he is, thank you, thanks Nigel. In terms of some of the barriers, resource constraints and capacity issues, you'll not be surprised to hear, was a major barrier. Carer identification and engagement, with so many of the projects being around identifying and engaging carers, obviously that's a barrier that they've been learning to overcome. Digital literacy and accessibility I've mentioned, but that's been a major topic, both for social care practitioners, but also people in the community. So how we overcome digital literacy, especially when there's lots of different people involved with different levels of knowledge, is the key point here. Stakeholder mapping, stakeholder engagement and partnership working, another barrier. And then finally, lack of awareness and understanding of systems. And then in terms of enablers, we need to be focusing on governance and resource management. We need to be focusing on technology integration and adoption. We need to be focusing on awareness raising, and focus. I can see there's a duplication there, so I apologise. And the key theme across barriers and enablers is collaboration. And I think this is particularly true of the kinds of projects that we've seen, where there's just, in order for them to have any kind of adoption and buy-in, every single partner needs to be involved. So co-production has been a really key and important thread within these projects. Next slide, please. So just a couple of case studies just to give you a little bit of a sense of what's been going on. So in Lincolnshire, we've been supporting Lincolnshire who want to improve unpaid carer support, helping connect with other unpaid carers and improving well-being and resilience. What they've been doing is offering arts, heritage and nature-based activities to improve carer well-being and help build a community. And then through consistent co-production, carers have shaped the activities and respite care provided, ensuring their needs are better met. So this is really about giving the carers a break, so to help prevent burnout, and they themselves have shaped what kind of activities they want to receive. And the Sky support is that we're helping Lincolnshire develop a blueprint model that they'll be able to share with other local areas. So the hope here is not just that the project will have impact locally, but that the project is also scalable and could be modelled in other areas as well. So the anticipated project impact is, this is an alternative to traditional care interventions, focusing on preventative support and offering carers tools for well-being. And a social impact evaluation is being led by the University of Lincoln, providing insights into the effectiveness of activities through qualitative measures. I should mention that all the projects were encouraged to do their own social impact evaluations, and many of them have partnered with local universities. So the key enabler here is co-production and stakeholder engagement. Next slide, please. This is another case study from Cambridgeshire. So the problem here was that social care practitioners in Cambridgeshire lacked confidence in having end-of-life conversations with unpaid carers. The innovation was a collaboration between health, care, and voluntary community and social enterprise sectors to develop a consistent approach and language, increasing practitioner skills, knowledge, and confidence. They reached over 100 practitioners through face-to-face training to date, and are now transitioning to an e-learning model with modules forming parts of grassroots training for newly qualified social workers. And they've got endorsement from Anglia Ruskin University on that. So a real kind of partnership approach to working. Sky support is we've been helping them on looking at the wider scalability and marketing of the e-learning to other local areas. So a bit like the previous Lincolnshire example, very much kind of grown out of local need and addressing a local problem, but in both cases they can see that there is a wider applicability and they're looking at how to scale it more broadly. In this particular case, I think there's also the kind of income generation angle of the e-learning that, you know, other people might be able to access it, and then it provides a source of income for the different partners. But anticipated project impact is holistic care journey for all involved, increased carer identification through proper conversation recording practices, and a more compassionate and skilled workforce who know how to have those difficult conversations. And you can see there from the quote from the CEO of Arthur Rank Hospice who was involved. I won't read it out, you can see for yourselves there. All right, next slide, please. So finally, how can Sky continue to support? So we at Sky were fully supporting the investment in unpaid carers. As far as we know, there hasn't been an investment of this scale before into scaling of innovation in social care, let alone scaling of innovations with an unpaid carer focus. And we recognise the significant potential of the innovation project supported by the Accelerating Reform Fund. So we'll be looking at exploring opportunities for ongoing collaboration to enhance the impact of the projects and ensure their continued progress. And we'll be looking at fostering sustainability by helping projects embed successful approaches, share learning, and build resilience for the future. I should say that the amount of support that we were able to provide last year through DHSC ended in March, but we are going to continue to provide support this year on a smaller number of projects, so not across all 122, but looking at supporting 15 projects in depth with bespoke business support, and then looking to continue the communities of practice, which have been very well received over the course of this year. So we should still have an opportunity to be able to gather really good learnings on how the projects are progressing to implement their innovations, and hopefully by the end of the year actually see signs of projects being embedded, adopted and mainstreamed, or in some cases projects failing to do so. And I think the learnings across both the successful and unsuccessful projects will be really, really crucial. So we published, as I said a moment ago, a report yesterday called Embracing Change, which provides an overview of the barriers, enablers, insights, and recommendations to date. We'll be doing another kind of iteration of that report in a year's time, looking at the next stage, implementation and adoption. And I hope there'll be some really good things there about kind of, where the projects are at and what success looks like and what you need to do to have a successful innovation journey. So that's it, I think, in terms of the slides, and we're very happy to open it up to any questions or comments that you have.
Thank you, Chris and Nigel. Yes, so if you've got any questions for either Meg, Nigel or Chris, please do post this in the comments box or put your hand up and I'll bring you in to speak. Just give you a few seconds to mull that over. Susan, please do come in.
Thank you. Good morning. Thank you for the presentation. It was just maybe not so much of a question, but a comment, because I know I was talking to somebody who is doing occupational therapy placement in an oncology ward. And one of the challenges that they've met was having a conversation with a family member where the loved one is end of life, and trying to have a conversation about how you plan a safe discharge, but having that conversation around, the setup at home, then causing a bit of upset because the prognosis wasn't good, because they've been told that the person is at end of life. So having skills in what kind of conversation you would have, I think, is a very useful tool. So that's the comment I wanted to make, really, in connection with some of the conversations that could be had in end of life situations.
Thank you, Susan. Have we got any other more questions or comments that people would like to come in now for either Nigel, Chris or Meg? Okay, one of the things that came through from your presentation, Chris and Nigel, that really seemed to come quite through strongly was co-production. And we're actually in co-production week this week. There's a number of presentations going on facilitated by NHS England. And you talked about that co-production in Cambridgeshire Link. I can see Lincolnshire. I can see that Steve's asked, Steve from NHS England, has asked for a list of participants for projects and potentially to invite them to come and talk about what they did in a little bit more detail at one of these ICS meetings. So I think that'd certainly be great if we could get a couple of organisations come along. Love that co-production theme. That'd be great to hear on that, how they pull together those projects with carers and other stakeholders. So I'll just give another couple of minutes for questions. Any more questions or comments?
And just to say on that co-production point, on our website, we've got, I think, about 12 or 13 case studies now that go into quite a lot of depth as to, these innovation projects, and co-production is a really strong theme. So please feel free to have a look at those And any of those that you think actually might be of interest for further conversation, or if you want to speak to them directly, please just get in touch and we can make that connection.
Thank you. And there's a question there from Hannah. Can you still apply for funding? I believe this is to do with the Accelerated Reform Fund. So the funding's over, isn't it, Chris and Nigel?
Yeah, it is. Yeah, it's been allocated.
Yeah. Okay, great. And Meg, you were talking about co-production as well in terms of like data and data use and data sharing and that sort of involving carers, young carers and their parents. Is there any sort of tips that you could give us in terms of that co-production when looking at data?
I think it's important to drive like a personal and relational touch when it comes to co-production within the local areas, and really understand like the systems that are currently set up there, and how they're impacting the young carers and their families. I think also, as you mentioned, some of the issues with like marginalized communities and not feeling safe to come forward. A really good area for co-production would be with global majority and low income households and those with mental health issues and substance misuse issues. Would be a really good method to get into the depths of why those young people and families don't feel safe coming forward, and how we can tailor support offers and needs to suit both their like cultural and family context.
Brilliant. Thank you, Meg. Okay, any more questions before we move on? Okay, we might be finishing a couple of minutes early then. Thank you, Chris and Nigel, and Meg, for taking the time to present today, for giving us your time today. Thank you very much to Steve Mabara, who continuing in the background pulls these meetings together and has done so over the last few years. Steve actually was also pulled together a conference last week. So a great big thanks for you there, Steve. It was a fantastic conference. I can see applause coming up. There's been plenty of that this week for you, Steve, and rightly so. I see you had your hand up there, Steve. Did you want to come in?
No, I meant to put my thumbs up. But...
Oh, okay. Thumbs or hands. Okay, and I can see that Chris has posted his email in the comments box. So thanks very much, everybody, for coming today. I'm not sure whether the long-term plans come out because we've been on this call, but I'll certainly be checking the NHS long-term plan straight after this call. I hope you have a lovely day, and I hope you find the ice cream of your dreams over the summer. Thank you very much. Should we just hang